had 10,582 tests in the past 24 hours, which is great news. So please, anyone has any symptoms, come forward and get tested. And Queensland Health has done 8,723 vaccines yesterday. So we are now at 87.37% have had at least one dose, and 78.67% of Queenslanders are fully vaccinated. So can I just say a big thank you to the way Queenslanders have handled this pandemic. It's been nearly 2 years. Tragically, we've lost 7 lives, but the results have been really unprecedented compared to the rest of the world. Our businesses have been able to function, our children have gone to school, and we've fought back and contained more than 50 separate outbreaks. And like I said, the credit here belongs to every single Queenslander. So thank you, thank you, thank you. So our goal was to get to 80%, a double dose, to get as many Queenslanders as we could vaccinated before the borders open, because we know how important it is to reunite families, especially coming up to this really special time of year of Christmas. And I know people have said to me personally, some of them haven't seen their grandkids for the first time. Some of them haven't seen their aunts and uncles, their mothers and fathers. This is going to be a very, very special time of the year. And as a government, we've been very conscious of how important this is to reunite families. And once again, I want to say thank you to everyone who's been involved in our tremendous response, and to all the Queensland Health employees, everyone out and across all of Queensland that have gone out, and to every Queenslander who's gone and got vaccinated. I really do appreciate you doing this. So it was expected that we would reach 80% fully vaccinated target sometime this week. We can't predict exactly when, but we know it's going to be this week. And I'm very conscious that we want to give people certainty, we want to give family certainty and business certainty, but also too, it's a big administrative function now that government has to do. Police need time to set up, and we just want to make sure everything is in order and we can provide some additional certainty to families that want to reunite in time for Christmas. So with that in mind, our schools are finished this Friday. So our state schools are finished, and then all of our children will be out of school. Our National Cabinet on Friday will be given an update about the new Omicron variant. And of course, as I said, our police and our administrative arms need some time to get everything ready. So to provide everyone with that certainty, I can advise that we will be bringing forward the opening date of our borders from December 17 to 1 a.m. Monday, December 13. So I'll just say that again. Instead of December 17, it will be as of 1 a.m. Monday, December 13, Queensland borders will reopen, especially to those hotspots of New South Wales and Victoria and ACT. So fully vaccinated travellers from interstate hotspots can arrive by road or air, and the Commissioner will go through in a little bit more detail. We do expect it to be very busy, and we do want to make sure that we are processing as well. There's a lot of people who've been caravanning and who are, right at the edge of the border there. They've been there for some time. We really want to get them through smoothly as well, so we'll be speaking with them. Now, you must have a negative COVID test in the previous 72 hours. So please, got this date now, so you can go and start organising that test. And no quarantine is required if you are fully vaccinated. If you are not fully vaccinated, you must arrive by air only and hotel quarantine for 14 days. So there are two important changes I just want to mention. First is that you will no longer have to wait the 2 weeks after your second dose to be considered fully vaccinated. The national guidelines say 1 week is enough, so we will adopt the national guidelines. And secondly, all arrivals from domestic hotspots must get another COVID test on day 5 when they get here, and there'll be penalties applying if you don't do that. South Australia has an additional requirement about when you actually come into the state. We are not adopting that. We've been through it, but we are going to adopt the day 5. So you need a negative test before you come here, and then on day 5 you need to go and get a test. And then of course our mandate on cafes and clubs and stadiums and music venues and everything still takes effect on December 17. Now, in good news for our border communities. Now, I know this has been very, very tough on our border communities, and thank you for your patience and your understanding. But from Monday, vaccinated border zone residents will be able to move freely across the border for any reason. You will need a border pass, and the border pass will run for 14 days, but you will not need a test. There is currently a hotspot declared, and that will be out of the border bubble, and we will address that if there are any changes. But we know that it has been extremely difficult for our border communities, and we're hoping to provide some greater flexibility and freedom of movement for those communities, and we will outline that for you on our website. So I'll hand over to the Commissioner, but as you can see, that's very good news, and Cabinet has endorsed this plan as well today, and I'm very happy to provide it to you following our Cabinet meeting. So I'll hand over to the Police Commissioner. Thank you.
Thank you, Premier, and good afternoon, everyone. So as of Monday, the 13th at 1 a.m, as you can imagine, the QPS has undergone extensive planning and preparation ahead of the broader restrictions easing. So it's a massive milestone for people, so we're expecting a lot of people to be travelling into Queensland. As a result, please, we are expecting extensive delays. So I need everyone to, and I think we should use this as a bit of a quotation, plan ahead and pack their patience. This is incredibly important. To speed up the process, make sure that all of those travelling into Queensland have a border pass that is clearly displayed and easy to see. And motorists, please consider travelling out of those traditional peak hours. Police will be meeting you at the borders. Particularly on the road borders, we'll be conducting anywhere from random to 100% compliance checks. So please be mindful of that, random to 100%. Vehicle technology will also be used. That means that every vehicle coming into Queensland will be scanned, and this allows us extraordinary benefits in follow-up inquiries. We, as always, will adopt the approach of compassion and communication and education first and foremost. But as always, those that blatantly disregard the directive, there are heavy, heavy fines, $4,135. Lastly, what we have done recently to make the process a little bit easier, the heavy vehicle checkpoint's actually been relocated to Coomera. So what this does is allow a better flow for all the other vehicles coming through. Having said that though, we still expect extensive delays. Please be patient, travel out of that high, very, very difficult period, the peak hours, and that should obviously assist you. Be patient, work with us, and obviously we always find when we move the border declarations a little bit, it does take us a couple of days to get things moving smoothly. But I'm sure working together as we always do, we'll do very well in this space as well. Thank you.
Thank you. And just to go back a step, there are 3 new cases today. 2 of those are domestic arrivals, interstate arrivals and in hotel quarantine, and another one is an international arrival. The really good news is that there's no local cases. Also good news is there's no local cases on Gold Coast at the moment, which continues to be wonderful. The residents of the aged care facility there, we're in the process of reconciling all the tests that those residents have had. 89 out of 92 residents have had their tests come back and they are all negative, which is, again, great news and wonderful work by both the aged care facility and the Gold Coast Public Health Unit. The most important part, though, is that we're about to hit 80% and we're about to open up. And that's what we've been working towards for the last 2 years. And we're there. Who would have thought that we'd be there with the small number of cases that we have had? This is world leading. Queensland's done an amazing job. But what it does mean is this is just the start. And as we open up, even with an 80% double vaccination rate, it means we are far better off than many other countries, many other jurisdictions in Australia. But we will have cases. That's inevitable, and we have to be ready for that. As cases come into our community, it's likely that we will need to think about wearing masks again. It's likely that people will need to be in quarantine. it's likely that some of our family members and relatives will get sick. So as people, and remember, the vaccination stops people getting really sick. It doesn't stop people getting COVID. So we just ask everyone to think about that. As our borders open up, think about if you're going into crowded places or if you're visiting elderly relatives, wear a mask. If you've got symptoms, come forward and get a test. And if you haven't been vaccinated already, get vaccinated. But this is the real thing, is be ready that we will see cases of COVID in the community. We have to be ready to live with that, not just live with COVID, but live with cases of COVID. And that's the path we're on now. But great work, Queensland. 80% double vaccinated, wonderful. And if you haven't already, please get vaccinated. Thank you.
So great news that we're being able to bring forward our opening up a few days, but also with our change to the definition of fully vaccinated to only require 1 week after the second jab. That means that a whole lot more people are going to be able to travel a week earlier than they planned as well. So we're pleased to be able to do that. But of course, the important step is adding that new test at day 5 after you return to Queensland or you come to Queensland. We do this because we've had 46 positive cases from interstate since we opened up at the 70% mark, and of those, around 87% have been detected in the first 7 days. So we know this will help us detect the majority of positive cases from interstate arrivals and to be able to contact trace very quickly. Everyone should be prepared that when we start getting cases, that we will have targeted restrictions. There may need to be people going into quarantine who are close contacts, and also mask wearing. And that's where our check-in system has never been more important. Now, we are starting to notice a lot of people going into venues not checking in anymore. This needs to change. This is more important than ever, because when there are cases, and there will be cases, but they could very well be where you have been, where you work, where you shop, where you've gone and had a drink, we need to be able to let you know that you have been in contact with someone's positive, and we can't do that quickly and easily unless we have your details through the check-in app. So please make sure you're checking in. Businesses, asking your patrons, making sure they're checking in. It's everybody's responsibility to make sure that happens. Now, how quickly can we expect this to come? Well, we only need to look at the last 7 days. In the last 7 days, we have had 24 positive cases in Queensland. 24 positive cases in 7 days. 20 of those from interstate arrivals, and another 4 community transmitted in Queensland that we know are linked to New South Wales. So 24 as a consequence of interstate arrivals, and we can expect a lot more of those cases once we open up. So while we all celebrate opening, we have to make sure that we do everything we can to slow down the spread and to support our health workers and to reduce the pressure on our health systems. And that is checking in, socially distancing, checking if you've got symptoms and going and getting tested, and importantly, if you haven't got your first dose of vaccination yet, please come out this week and get vaccinated, because this virus is going to be spreading throughout our communities, and we want to make sure we're keeping people as safe as possible so we can all enjoy a wonderful Christmas with family and friends.
On day 5, when people need to get a COVID test, they need to isolate, or can you just get a test and go out and go in the community still?
Oh, just get your test and then you'll get your result. But if you come back positive, then you'll have to isolate.
Can you guarantee the border won't close again?
Sorry?
Can you guarantee the border won't close again?
Well, it's not our intention at all. I mean, we've agreed to the national plan, and we're working to the national plan, and the vaccination rates are really high. Never did I think that we would be in such a good position to not have had widespread community transmission and opening up with 80% double vaccinated. In fact, we're very close to hitting the 90% first dose. So if you're out there and you have not been vaccinated, time is running out. As we know, this is the pandemic of the unvaccinated, and if you've got a family or friend out there, please urge them to go and talk to their local GP. I understand people have some concerns, so go and sit down with either a friend who has been vaccinated or your local GP or a nurse.
I mean, further to the Minister's comments about the danger that could lie ahead, you encourage nonetheless by the decreasing death toll, the rate of death in New South Wales. Does that augur well? Do you think it was
Yeah, I think New South Wales has done a very good job. I mean, they've got very, very high levels of vaccination, and they had a massive outbreak. We have not had that situation here in Queensland, but we've been able to get our population vaccinated, and this is the best position we can be in. I also acknowledge it has been a very tough time on people who have friends and families who live in different parts of Australia. Christmas is a time to bring families together, and I'm asking people to make sure you get your test, your PCR test before you come here. Fill out your border form appropriately. Make sure you have those contact details there in case anything does happen. And please, if you are sick, Queenslanders all stick together, and if you're coming into our state, we welcome you into our state, but please, if you could follow some of our guidelines, which is if you are sick, go and get tested and use that check-in app. Very, very important.
How prepared are your hospitals?
Yeah, the hospitals are ready, and there's been a lot of planning, and this is no different to work that's been happening right across the country.
Premier, some Indigenous communities have quite low vaccination rates. Are there any provisions for those communities to be protected once this border opening happens?
Look, I've been encouraged. The rates are increasing, and as I said, we have one Queensland, and the vaccination rates have increased. We will monitor to see how that goes, of course. But the Northern Territory have been able to get on things very quickly, so of course we will monitor it. But I'm very hopeful that our high vaccination rates across the state, I could not be more proud as Premier. Queenslanders have really answered the call to come forward and get vaccinated in their thousands.
And that modelling you got today, do you have any further indication when we'll hit 90%?
We anticipate 90% hopefully by the end of this month, maybe in that Christmas week, and we are predicting at this stage that we would hit 90% double dose around mid-January.
Are there any changes to what happens when we reach that 90% double dose rate?
Yeah, for the roadmap, there's a roadmap there that articulates.
Nothing's changed on that front though? It
No.
still remains at the...
Yep.
With the 80%, we were obviously told, as the press release says, we're always opening at 80% double dose.
Yes.
If that is happening this week, why not set Monday date a little bit earlier?
Because we could have waited till it was Wednesday or Thursday, and then we need a week to put everything in place, and it would only have been a day before we were due to open. So this gives certainty. We sat down today, we really worked through this, and also too, a lot of parents still have children who are finishing school this week. School finishes on Friday. Of course, the federal government is approving the vaccine for children mid-January in time for the school year to go back as well. The last thing I think parents would want is community spread, anything affecting their school kids in the last week as well. So we took that into consideration.
Premier, with the Omicron obviously happening in New South Wales in
Yes.
cases, how much did that weigh on your mind? Was there any consideration to just pausing this opening?
Well, of course, it weighs on our mind, but the information we've been told, and of course I've said the Prime Minister is leading this, and we'll be getting a full update at National Cabinet on Friday. And if the Prime Minister and Professor Paul Kelly have the most up-to-date information and they don't have any concerns, well, I have to listen to the experts.
Will you consider pushing back the start of school so more primary age students can get a chance to get vaccinated?
Look, I think we'll be fine. It'll be available. Our parents will be able to make that choice about their children, but there have been some parents who have been concerned, and the federal advice allows children to get that dose of Pfizer in time for the school year.
Can you explain how the border bubble is going to work? Is it just for people that live there, or can people who are holidaying on the southern part?
Yeah, it's people. My understanding, I might get Yvette to go in a bit more detail because she's been working on that more closely. Yep.
Thanks. So this will apply to movement within the border zone. So anyone who lives in the border zone have to be fully vaccinated. So this only applies to fully vaccinated. If you're unvaccinated, the same rules apply as exist now. So only for essential purposes. But if you are fully vaccinated with the new definition of 2 doses plus 1 week, you will be able to move across for any reason whatsoever and not require a PCR test as long as you have that border pass, and that border pass will last for 14 days. That includes people in Queensland being able to go into the border zone for a day trip, or to visit family and friends, they would need a border pass, but they only need to be fully vaccinated. They won't need a PCR test.
For example, if I live in Brisbane and I wanted to go to Byron Bay for the day, and I live in the border area to get a border pass, and I would need...
As long as you are fully vaccinated, meet that fully vaccinated definition, you won't need to get a PCR test. You just get that border pass and you'll be able to go do day trips.
And what is the circulation of that border bubble? What does it extend? How far south?
It is the current border zone, as we've been operating under for some time. But of course, remembering in that border zone, we also have one declared restricted zone at the moment being Moree, and it will have its own particular restrictions around it. So there is a hotspot declared within that border zone currently. That could change going forward. We hope Moree doesn't have to stay that way. And other areas could end up being deemed hotspots. But at the moment, Moree's the only one where there are restrictions. Otherwise, it's the current border zone, which people can easily find on our website.
Just to
Clarify,
clarify,
a day trip's in then, if you go from Brisbane to Byron?
Yes, you can do day trips in. And as long as you're fully vaccinated and you've got the border pass, you'll be able to come back into Queensland and not need a PCR test, but only if you're travelling within the border zone. If you go any further than that, then it will be the normal restrictions.
With an overnight stay?
That's fine, as long as it's still in the border zone.
what would you like to say by way of reassurance to Queenslanders, given the dire nature of some of the more recent modelling on the number of deaths, like 200 within 90 days, we read at one stage, given what's happening in the other states now, and the extent to which things are relatively under control, is there anything you want to say by way of reassurance to those who've done the right thing up here on this side of the border about the ongoing risk?
Well, the reassurance is that the Premier and the government has released a sensible and responsible plan to open our borders. We're doing it in a safe way that will see the virus come in, but come in at a slower rate. The social measures that will come into effect, mandating vaccinations at certain businesses from the 17th of December, will help again give everyone who's done the right thing and come out and got vaccinated, say to them, you can go to these venues knowing that everyone there is vaccinated. So we are doing everything possible of opening up our borders, but at the same time slowing the rate of this virus coming in. But it does require for Queenslanders to do their part in making sure they're checking in, making sure you're going and getting tested if you have any symptoms, and of course those people coming across the borders, making sure they're complying with those border passes, including their day 5 tests.
Minister, people in home quarantine already that have come in after 70% trigger, what will they need to see out there?
So anyone who's in home quarantine as of 1 a.m. on Monday next week will be able to leave home quarantine if they're a domestic arrival, as long as they've gone and got a PCR test in the previous 72 hours. So sometime in the last 72 hours. So basically, if you're in home quarantine that was supposed to go beyond 1 a.m. on Monday, from any time Friday, go get your test, wait for your negative result. If you have that negative result in your hand, come 1 a.m. Monday morning, people from home quarantine will be able to leave.
And are we expecting the border pass system that's come in for the border zone and the checks on the borders for the 0 up to 100% compliance to end once that 90% triggers?
Well, let's get the 80% open first, and let's get to that 90% double dose. You know, we've got to keep driving those vaccination rates there. We're not 90% first dose yet. We want to get to 90% double so we can implement the plan that we have already released publicly.
Minister, I think I remember seeing an original estimate for January 6th, or maybe around that, for double dose 90%. That's obviously now mid-January.
Yes, the first doses have slowed a little.
Vaccination rate that last 14%.
Look, I want people to come out and get vaccinated as quickly as possible. Sadly, I do think once we start getting cases, we will see an uptake again. That's good news that we'll see an uptake in vaccinations. It's sad that we might have to wait for that to see a big surge. But I'm confident when our borders open at 1 a.m. next Monday and our social measures come in on the 17th of December, that the last few people who are still to get vaccinated will understand the importance of coming out and getting vaccinated quickly.
Just quickly, can we get a quick response to you from the Auditor General's report on
Sure, absolutely. Look, I welcome that report. I'm pleased that the findings show that there has been improvements, but we have seen, again, some increase in those longer wait times for some elective surgeries. I welcome the recommendations. That's exactly what we've been talking about. Demand is outstripping supply at the moment, and we need to look at working better with our GPs, with primary health networks, and improvements within the health system to streamline the sorts of things we've been looking at, EDs, bed capacity, all of those sorts of things. So there was no surprises in that report. That's exactly what we've been saying for some months now. That's what we've been raising with the Commonwealth, and I welcome the acknowledgement that there's been some really big improvements in our specialist outpatient clinics as well.
Can I ask a question of the Commissioner, if that's okay?
Yes, thank you.
Commissioner, you mentioned there'd be anything from something to 100% compliance. Does that mean you won't necessarily be checking every single car? And further to that, have you got any projections on what sort of delays may be seen on the road borders once we do open up next Monday?
So the reason why I say 100% to random checking, depending on what time of day it is, depending on where it is, depending on what the flows are like. So that's all of the dependencies that we're looking at. So don't think you'll come into Queensland and you won't get intercepted. You're likely to. And a lot of times we'll get information, behind the scenes about people doing certain things as well. It's hard to predict exactly what time frames, but I expect they will have to be extensive. I just know the sheer amount of caravans, waiting across the border to get in. Can I ask those that don't need to travel in peak hour to please choose, maybe from 1 a.m. onwards, not all at 1 a.m. please, but certainly through the night, middle of the day maybe, but please keep away from those peak hours. That is at the moment, quite a big burden in itself. I do expect extensive delays, so pack the patients.
What are the numbers that we're looking at? We've seen the figure diminish with home quarantine introduced a couple of weeks ago. The border pass system's been ramping up somewhat compared to what was like in September, October. So how many people are we left with wanting to get across the border beyond next month?
I would think it would be in the tens and thousands. That's just a rough guess. But just if we want more people to come into Queensland on holidays too, don't we? 20, 30,000.
Queenslanders coming back.
Yeah, Queenslanders coming back. And look, that's hard because what happened was when everyone knew we were getting to 80%, a lot of people dropped off that, flying in list. So knowing that they could come across the borders. So it's not an exact science, but I'm sure it would be in the thousands.
The holidays are still a way off in terms of the school break. So what are you preparing for?
The holidays are here from Friday, and in fact a lot of the schools already, a lot of the senior schools are on holidays. Looking forward to a safe holiday, and this is not just a message about COVID. We have a terrible road toll at the moment because people simply aren't doing the right thing. So I ask patients all around, wear your seatbelt, don't speed, don't drink, drive safely, and please, particularly as the holidays are coming, make sure that you drive safely as possible and keep your families safe.
Last one, Premier, what numbers would we have to see a mask mandate trigger again?
I think you'll see people make up their own minds, especially if they're in crowded areas. I think people, once they start seeing case numbers, and if it's in their particular area, they might start wearing masks. I think people will use their own discretion.
Premier, have you read the CCC report yet, and do you have confidence in knowing?
I haven't read the whole report yet. Cabinet has resolved that we will take some further advice and we will consider that at the Cabinet meeting in the new year.
With the vaccine mandate from the 17th of December, are businesses going to be able to see that health directive soon?
Yes, they are. There'll be an update on that in the next couple of days. Good question. Very good question.
Is that advice being taken from the Premier?
Sorry?
So Cabinet seeking further advice from the Triple C report?
They're Cabinet deliberations, Lydia, and unfortunately you're not in Cabinet. That's all right.
When is this going to be taking place, or is it just business as usual until the new year?
Sorry, this is the last Cabinet meeting was today, and then we resume next year, same time the schools go back.
What are your views on Alan expiring and the
I told you, Tim,
made by the report that
actually you weren't here on Friday, and I said very clearly on Friday I'm not commenting anymore until I read the report. Sorry, and until the, my apologies, until Cabinet considers it.
Good poll result for Anthony Albanese this morning. Do you have any friendly advice for him in terms of your recent assurances to the mining sector, that job security, and the way it's going to be managed by the Queensland government, given the zero net emissions?
Well, let me just make it very
What would
clear.
you say to Mr. Albanese about what what you're doing.
You trying to draw me in on the federal election?
Yeah,
No, you go and ask the feds about that. I'll stick to state politics. Thank you very much. See you night. Have a nice day.